We will speak in general, firstly, about the skin. What is the skin? We will repeat and refresh our knowledge about it, and we can make sure that in the end of the lecture, you will know how to deal with the skin pigmentation. So let's start. What is the skin? Who can answer me? Do you remember what is skin? It's the largest organ of the human body. Yes?
Yes.
Okay. It covers all over our human body. It is the barrier or the protector of our internal organs, guys. You don't remember? Let's continue. So it is protecting our internal organs from several things. It's protecting us from microelements or microorganisms. Yes. What's more, protecting us from UV light. We will speak about UV light today a lot because UV light is one reason or one cause of the skin pigmentation. Yes? Very good. Then, what is the skin function? Who remembers skin function? Okay.
Thermoregulation.
Yes, thermoregulation.
Yes.
What's more? Other function of the skin?
Vitamin D synthesis.
Yes, very good. Other function? So we have spoke now about vitamin D, and we spoke about thermoregulation. What's more? Shaima. Protection from what?
UV.
From UV light. What's more?
We can give also as a barrier.
Barrier, yes. So it's playing role in our immune system to protect us from the microorganisms. What's more? Other function of the skin? Ikram. What?
Sensation.
Sensation, one of the most important role that our skin is playing because it have a lot of nerve ending. It is giving us the sensation. It is unique feeling that we can feel everything around us. We have something else to add? No, we're going to the next slide. Skin structure. It is the largest organ, so it should have special structure. In our skin we have 3 layers. What they are?
Epidermis, dermis, and subcutaneous.
Okay, so we have superficial layer, which is the epidermis. Then we have middle layer, which is dermis. It is the main layer of the skin. Then we have below it the hypodermis or subcutaneous. Very good. Let's speak about epidermis. It is the outer layer of our skin. It is playing role in protecting of our skin. Why? Because it have the corneum layer. What is the corneum layer?
It's the dead cells.
It is the dead keratinocytes. Have no nuclear, no energy, so no bacteria, no fungi can live above it. So it is protecting us from anything penetrating our skin and getting energy. Okay? Then, how many layers do we have in the epidermis?
5.
We have 5. In some books says 4, but it is usually 5. Why? Because we're starting from the basal layer, then above it we have spinous, then granulum layer, then lucidum. In special places they are palm and soles because they are thick skin. Then we have the corneum, which is dead keratocytes. This is the main protecting layer of the epidermis. And in the epidermis we have unique function. It doesn't look like other skin because it's regenerating. How long it take to regenerate? 40 days to regenerate. Very good. Okay. We have special cells present in our in the epidermis. We have the keratinocytes, we have melanocytes, and we have Langerhans cells and macro cells. They are responsible for sensation. Melanocytes, we'll speak about them today in detail. Melanocytes, they are producing melanin. They are answering for our skin color. Whenever your genetics produce more of the melanin, that means your skin will be darker. Whenever it is less, you will be more white or yellowish. Yes? Do you have a question till now? Is it okay or too fast for you?
It's okay.
Is okay? Okay, let's continue. Dermis. It is the second layer. It's located under the epidermis. It's connecting with the epidermis by hemidesmosum. Yes, it is special, like junction between the dermis and epidermis. So because of that, our dermis and epidermis connected very tightly, and they will not be separated. Then we will speak about dermis itself. What we have inside the dermis? Okay.
nerve ending.
Nerve endings. No, we have the nerve itself because nerve ending is ending to the epidermis. Okay. What's more? Capillaries or vessels. What's more?
Glands.
Glands. What kind of a gland? Atallah. Huh? Sweat glands. And what other? Species gland. What is the function of species gland? It is producing the sebum. It is lubricating our hair and keeping it moisture to not be broken. Yes? Okay. What's more we have there? Hair follicles. What's more? Okay, from what it consists of? We have the collagen fiber, elastin fiber, and the fibroblast. You remember them? And we have two layers there. We have papillary layer and reticular. Papillary is superficial, small, and reticular is bigger. Yes? Very good. Then we have sweat glands, species gland, and hair follicles. We spoke about it already. You are a very good student. Then, what is the function of dermis? Function of dermis. Secretion. Yes, one of the function of the dermis is secretion. It is the supplyment by blood vessels to the epidermis. Yes, it have the nerve, so it will give us the sensation which we feel in the epidermis. Okay. Later we have what? Subcutaneous. What is subcutaneous? It is the fat layer, or the fat is what? Guys.
Neurovascular
Huh?
structure.
It's more neurovascular, yes? You have like more of vessels and more of nerves inside it, yes? Okay, subcutaneous, it is connective tissue and fat together, and it is the largest amount of the skin layer, like it's the biggest of the, yes? Melanocyte, what it is? Let's speak about it.
Melanocyte is the cells which produce the melanin.
The cells which produce the melanin. What is melanin? Who can answer us? Yes, Khan.
It's a pigment that prevents the ultraviolet radiations.
Yes, so melanin, it is producing the pigment which are protecting us from UV rays, yes? Yes. Whenever we have more melanin, which color we will have?
Dark.
Dark color, yes? And when we have them less, we will have
White.
the white. Again, we're repeating the same information. In some cases, we will have absence of melanocytes or absence of melanin. What will happen to the patient?
Albinism.
Albinism. What is albinism?
Lack of melanin.
Absence of the
It is
melanin.
totally absent in the body of
Melanin.
melanin. So this patient will be very sensitive to the sunlight.
Yes.
And other condition we have a special autoimmune disease which called vitiligo.
Vitiligo, yes.
Vitiligo is that condition that we are speaking about.
Hypopigmentation.
We're having no melanin in some special part of the body which will cause for us hypopigmentation or depigmentation. In this mean like we have in this area totally absent of the melanin. What is the skin pigment? Or skin pigmentation? Who can answer me? You will get something from your CV.
What's the question again?
What is skin pigmentation?
Like pigmentation just now, as you said, like it's the melanin.
Yes,
So,
it is the
but
presence of melanin.
But
Yes.
sometimes in few places maybe just it overproduction, so it causes little darker in the specific area.
Okay,
maybe.
so the pigmentation is the protection and the more producing of melanin. So whenever you have more melanin, you are more protected from cancer. You can take it.
Thank you.
You are welcome. Then, what we will speak? Causes like of skin pigmentation. Who can tell me about it?
Causes of skin.
Like we have the special layers
Yes.
of the skin. Inside those layers we have melanin present, yes? In this melanin what we have? No, they are melanocytes producing the melanin. Melanin is giving us the color. So whenever we have more secretion of melanin, we can have color. When we have like less, we are going back to the light. We can putting two different color, white and black. Whenever more, going to black
Yes.
and going
Like within the range.
within a range. We have like the range black and white. Between them we have the color of our skin. I have a special picture I will show you later, maybe after the lecture, because unfortunately I cannot show it on the screen. Then we have like two type of melanin. We have eumelanin and we have physiomelanin. What's the difference between them? Eumelanin is responding for which color? No, brown and black. And physiomelanin, they are for no. Yellow and red color. Yellow and red color. You got it? This is
Yes.
the main function of them. The black is more. No,
Protective.
the black is better protecting from
UV rays.
UV rays. So this patient
Will have
Will
less
not
or
have
those
less.
people will have less chance to
Chance to
get
have
cancer.
cancer.
Remember, dark people have less chance to get cancer and skin pigmentation or like skin hyperpigmentation, hypopigmentation. Okay? Then we have other things we will speak about. Discoloration. Now all of us have special color of the skin. It is looks similar everywhere. It is the normal condition. But in some cases we will have discoloration. Yes? What does it mean discoloration? That in one area I will have change in the color of my
Other surfaces.
of skin,
Or
especially in one area. We will have what kind of lesion in that case? We will have flat lesions. What flat lesion do you know? We have macules and patch. So whenever you have this discoloration, it can be three types: hyperpigmentation, hypopigmentation, and depigmentation. Okay, who can tell me what is hyperpigmentation? Raise your hand, guys. Okay, Kumar.
Sir, hyperpigmentation is when we have in a particular site high production of melanin.
Yes, so it means in that area we will have hyperproduction of melanin. Okay, very good. Then, in hypo, we will have deficiency of the melanin, so less producing of the color of this area. What is depigmentation? It's total absence of melanin. Very good, guys. We spoke about it, like we have hyperpigmentation, hypopigmentation, and we have what else? Depigmentation. Depigmentation again, we will see it where? We will speak about it later. You forget. I just said we will see the depigmentation, but now we will speak about hyperpigmentation. The skin in some area will become darker, like it is different abnormality in the color in a specific area. Okay, what is the cause of hyperpigmentation? Who can answer me?
Cause of hyperpigmentation.
Yes, hyperpigmentation.
Excess production of melanin because of hyperpigmentation.
Yes.
The same excess production of melanin.
No, causes. Like it is the function. You will have like pathology in the melanin, so you will have the hyperpigmentation. But what the causes? Diseases maybe.
Okay.
Melanoma is cancer. It's not skin pigmentation. It's have other lesions. Yes.
The cause would be the sunlight exposure to the
Yes, exposure to the sun. You can come to take it. One of it, like, is exposure to the sunlight. To the studio. Okay, what's more? Hey, think, come on, guys. You are again raising your hand. No. Give other chance. Maybe Abdullah knows. No? Osama. No, I want to give you a gift. Maybe you will answer something. You have it on your face. You have it on your face.
I forget the question.
Causes of hyperpigmentation. You have it on your face. What do you have on your face? Yes. What acne left on your face?
Scar.
You see? I wanted to give it to you. They left the acne scar can cause hyperpigmentation. Yes? Yes. Other cause and I will continue. Last one.
Sir, maybe inflammation.
Like inflammation, no. Yes.
Or sometime reaction to any drugs and all.
Huh?
Sometime any reaction to the drug. Any
Reaction to the drugs. Yes. Very good. Like especially antibiotics. Yes? Okay. Then antibiotics and other hormones drugs. What the hormones drugs do you know? No. Female, what they are using to protect themselves from getting pregnant?
Estrogen and progesterone.
Like, yes, they are causing as well hyperpigmentation, yes? And we have like sometimes cryotherapy, laser therapy, and light therapy also can cause hyperpigmentation. Okay. Pregnancy is also giving hyperpigmentation in some cases, okay? Hypopigmentation. What is hypopigmentation? We said like it is the skin in some area will be lighter than the skin tone, yes? Why? Because the melanin abnormality, like low amount of the melanin, or as your friend said, what happened to the melanin? Deficiency, yes? Okay, causes of hypopigmentation. Yes, Atallah.
blisters, burns,
Burns, infections.
cosmetic treatments.
So what does it mean? Those what will live on your body.
They will make the color
Eat.
better.
In come on. Like you said burn due to what? To some injuries like burning and injuries. It's for you. You are welcome. The last one. For whom? Mahmoud, you have to answer, yes?
I wanted to say trauma and injuries.
Huh? Trauma
Injuries.
and injury. He said it. Other. What can happen to the skin that will leave for you like it will attack the melanocytes? What can happen to your skin?
Surgery can
No. Who said inflammation? Huh? Like inflammatory skin conditions. Remember it, guys. Inflammatory skin conditions, like psoriasis and eczema, okay? Then we will go to depigmentation. Yes, you can say genetics. Okay. John Kennedy. It is for you. Then we are speaking now about skin depigmentation. What does it mean, depigmentation? It is the totally absence of melanin. Yes, we spoke about it. It's the third time I'm repeating it. What kind of disease you will see there? Albinism is not disease. It is genetic disorder, but the disease is vitiligo, an autoimmune disease. Yes? Okay. Vitiligo, then treatment of hyperpigmentation. Yes? What is the treatment of hyperpigmentation? Hydroquinones. Yes. What they are? They are medications that are very common and we are using them usually to hyperpigmentation. Second, what is it? We can use corticosteroids. Yes? Trination and corticosteroids. What's more? Yes. Think about it. What like girls like to do to their skin?
SPF. Sunscreen.
Sunscreen, no, it's protection. Sunscreen is your protection.
Like liquids.
You can use chemical peelings. You said it, I didn't listen to you, but if you said it, yes, come to take it. Yes, it's for you. So chemical peeling, they will make our skin to regenerate faster. We will lose the outer layer of the skin, and we can renew our skin very fast and quickly and lose our pigmentation. Okay, we can use also laser therapy. Yes, what's more?
Surgery.
Surgery for pigmentation.
We can use it.
No, we are not speaking about scars, we are speaking about pigmentation.
What are retinoids?
Huh?
Retinoids.
Retinoids, yes, they can be retinoids somehow. We can use them with mixed with other drugs. What's more? Phototherapy can be. Okay, it's for you. You are welcome. So now, the last. Do you have any question about this lecture? Who have a question, he can raise his hand and I will allow him to ask. Okay.
In which situation is better to use hyaluronic acid? It can help anyway in pigmentation?
No. It is like in regenerating the skin, it will giving it like, you know, like more moist. It will give it a little bit of anti-aging effect. But for this condition, we will not use it. Okay, and especially, I want, yes, please.
Teacher, you said acne and blister causes hyperpigmentation.
Acne scars.
What is sad?
You know, like when you have acne, they are deep, you have the pustules. When the pustules, that means they are big. Inside, if they are big, they reach to the dermis. Whenever they reach to the dermis, they will change and you will have the scar. The scar usually it is darker color from your skin. Yes, so we will try to make chemical peeling, other stuff to change it. And on our days, we are using, like from the last months of the practice, I am using the dual serum anti-pigment from Eucerin. It's a great medication. It is affordable in price. You can find it in all the pharmacies, and it is doing a great job with pigmentation. They have line of 3 different anti-pigments. They have the day and the night and the dual serum. The day you are using it in the day with the SPF protection from the sunlight, and later you have the night, which you will put it before sleeping, and you have the dual serum, which have special effect on the pigmentation and giving a great result. Within 1 month, you will totally cure from pigmentation. Yes?
We can use surgical graft to remove the pigmentation.
Pigmentation is patch or macules for what you need to change it with the surgical. If you have a scar pigmentation or you have, you know, like total loss of some fibrosis you have on the skin, yes, you can make surgical. But in these cases, I told you the treatment, we have no surgical treatment. We have, or we are using medication, or we are using laser or like phototherapy. We can use them to change it. Okay, Shani.
I want to ask you about mesotherapy.
Mesotherapy, yes, we have special mesotherapy for
scars.
no, not for scar. We are speaking about pigmentation. For pigmentation, yes, we have a special mesotherapy, which also have the same medication, what we said, almost inside it, which will change and affect the melanin itself, and it will help them to reduce what? Like the melanocyte will reduce production of melanin. So because of that, your skin will come back to the normal condition and 1 tone. Okay, other question? Do you have other questions?
Are there possibilities of getting like maybe normal hyperpigmentation in one area and then hypopigmentation in one area in the same body?
Yes, it is possible. They are totally 2 different conditions, but usually we are meeting one of them, or hyperpigmentation or hypopigmentation. Okay, last question. Who will ask it? Who have the chance to ask last question? No questions more? Okay, then Thank you so much for your attention, and I am glad to see you over here. And I hope to give you other lectures, and whenever you have any problem with dermatology and you need to know anything about dermatology, contact me and I will be happy to help you with that. Thank you so much for your attending, and I appreciate to see you again. Have a nice day. Thank you.